This is the IV cannulation station. So we're going to walk you through how to properly set up an IV station, how to select a vein for cannulation, how to prep our appropriate equipment, how to prep the site for IV cannulation, perform IV cannulation itself, and we're going to hook the patient up to fluids, and we're going to adjust to appropriate drip rate. So before we begin, we want to make sure that we have all our equipment. We want to have various size angiocaths. Here I have an 18 gauge angiocath and a 20 gauge angiocath. We have a commercially prepared IV start kit. It's going to include everything that we need for IV cannulation. We have a separate saline lock with a normal saline flush. Here we're going to have a sterile gauze pack. We're going to have some way of cleansing our site. Here we have alcohol. We could also use a Chlorecept or a povidone iodine. And here we have our fluid. So the fluid that we're going to choose here is going to be a normal saline. It's going to be a 250 milliliter bag of normal saline. And because we want to do fluid administration to this patient, we're going to have a macro drip set. And that's going to be 10 drops per milliliter. So the first thing that we want to do to prep our fluids is make sure that we have the correct fluid. Once we remove it from its packaging, we want to make sure there's no particulate matter that is floating in there and that the solution is nice and clear. We're confirming that we have a 250 milliliter bag of normal saline, and we're checking the expiration date to make sure that it's in date. You'll see down here that we have 2 ports from our IV solution bag. The port on my left over here is a medication administration port. In the event that we would have to administer medication to this patient is where we would insert our medication to the bag. To my right is the port where we would insert our administration set. We're going to make sure that we have a 10 drop set, which is also called a macro drip set. First thing we're going to do is we want to take it out of its packaging. Now it's important that we maintain what's called aseptic technique. It's going to be difficult to maintain sterility, but we want to make sure that we don't contaminate any of our equipment that's going to be ultimately administered to the patient. So in order to spike our bag and to flush our administration set, first thing we want to do is take our roller clamp and we want to close it. And then without touching any of the surfaces to contaminate the equipment, we're going to remove the sheathing from our spike. We're going to go ahead and we are going to remove the administration set port cap. We're going to go ahead and just do a twist and pull until that spike is seated in the bag. With the bag in the upright vertical position, we're going to squeeze our drip chamber so that it's about 50% or about halfway full. Okay. And then we can hang our IV solution bag. What we want to do now is we want to flush the line. So I generally remove this protective cap on until we're ready to use it. So we want to make sure that we are eliminating any air bubbles within our line. Okay. And once we're satisfied, we can go ahead and secure it. Okay. So now we're going to prepare for IV cannulation itself. We're going to set our equipment up. We're going to prepare our site. We're going to let our patient know what we're doing. We also want a sharps container, puncture-resistant medical waste sharps container, to make sure we can immediately dispose of our needle after cannulation. Okay, so I have my somewhat sterile field here to work from and set my equipment up on. Next thing that I'm going to do is I'm going to prepare an IV saline flush. So I'm going to take this extension set. Okay, go ahead and open it up. Each of these extension sets holds about 2 milliliters of normal saline. We'll take our sterile flush. Right, and again, using aseptic technique, we want to go ahead and connect our flush to our saline lock. Flush that through, and we can go ahead and place that onto our sterile field for use. This commercially prepared IV start pack. So here we have a chloroseptic prep that would be used to prepare the skin. We also have tape, which we're going to prepare prior to IV cannulation. We have a venous constricting band. We have a tegaderm. And we have a second gauze. So next what we want to do is we want to prepare a tape. We want several pieces of tape to help us secure the IV catheter in place once we're done. Let's take 2 thin pieces. We're just about ready to perform IV cannulation. We're going to let our patient know. So we're going to need to start an IV to administer some fluids and maybe some medications to you. We're going to choose a 18 gauge if the person's vasculature would accept it. Once we're ready for cannulation, we're going to apply the venous constricting band. And we want to apply this in a manner where we occlude venous flow, but don't obstruct arterial flow. One way that we could check is by palpating a radial pulse. We want to make sure we still have a radial pulse, but we're going to try to engorge the vein. Now we're going to look for an IV insertion site. So generally you want to start lower in the hand and work your way up. And that's because if we have a failed attempt, we want to prevent infiltrating a vein, right? We could always go higher, but it's going to be difficult to go lower. Once we find a nice straight vein, right, one with not many valves, something that's coming up, we could palpate the vasculature, make sure that there's like a spring action that happens there. Right? And here we're going to palpate one of the veins in the antecubical fossa. So this seems to be an appropriate place to provide IV cannulation. Next thing I want to do is I want to prep the site. So generally we start where we anticipate we're going to begin IV cannulation, and we're going to rub in concentric circles, pushing all the debris away from the center. Once we cleanse the site, we want to not recontaminate the site, so we don't want to touch that site after it's been cleansed. We're going to go ahead and we're going to open our catheter. We have an 18 gauge IV angiocath. That's an over the needle style. Okay. And once the needle is released from its protected sheathing, we want to be careful not to contaminate it. We want to gently twist it to allow ease of insertion. We also are checking for burrs along here, and we want to be very, very careful not to push the hub up at all. We could get catheter shear, and that could be a potential embolus. I noticed the location of the bevel. The bevel is always upward facing on insertion, and we're going to use our thumb to go ahead and stabilize that vein. What we want to do is go in at a relatively shallow angle of about 45 to 35 degrees. We're going to perform our IV cannulation, so you're going to feel a little bit of a pinch, okay? Upon insertion, we should see this drip chamber fill with blood. And that's one indication that we know that we're in the vasculature. And we could drop down to about a 10 to 15 degree angle and then insert the catheter. Okay. At this point, we would release our venous constricting band unless we were going to draw blood. Right, and then we're going to stabilize our IV hub, and then we're going to use our finger to come distally to the catheter to occlude the vein while we retract the needle and immediately dispose of it in straps into the end. At this point, I'm going to hook up my IV saline lock. I'm going to pull back on my plunger to withdraw to ensure that I get some blood return. Okay, I don't want to let go of this hub until it's completely secured, so I'm going to lock that IV saline lock, and then I can use my tegaderm to go ahead and secure this catheter. At this point, we could finish securing this IV saline lock with some tape. What I like to do is provide what's called a chevron. This prevents the IV catheter from pulling out, so we place the tape underneath the hub, and then we're just going to crisscross the tails of our tape. Use a second to secure the hub itself, and we could go ahead and use a third strip of tape to secure the administration set end. Okay. At this point, we could take a clean alcohol. We're going to prep the administration port. This is called a lure lock system. So what we do is we press in and we twist until it is secured. Okay. We're going to open up the clamp on our saline lock, and we are going to use the roller clamp to adjust our IV drip rate. That's flowing. What we want to do is we want to ensure that there's no infiltration around the IV site. You would see some swelling. Potential complications include thrombophlebitis. If we see some redness, some irritation, those all could be signs of complications. We would have to discontinue the IV, remove it, and try it at another site. We're going to set this at a keep vein open rate, and that would be approximately 1 drop every 4 seconds. It's going to be about 15 drops per minute. And there we have it. We're going to monitor the patients for the desired effects, fluid administration. We're also going to monitor the patient for any adverse effects at this point.